Kate, what were you doing on July 30th, 1965?
1965?
Where exactly were you?
I was just a twinkle in my grandparents' eyes at that point.
And had you been alive, what would you think you'd be doing in late July of 1965?
Possibly laying out on a beach somewhere, enjoying the summer sun.
On July 30th, 1965, President Lyndon Johnson signed into law several amendments to the Social Security Act. And one of those amendments established Medicare, which we know is the health insurance program for the elderly. But why did Americans need that program in 1965? What was happening back then, do you think?
Oh my gosh, this is an unexpected trivia question. I don't know, maybe there was increased health needs from cigarette usage. I don't know.
Oh, that's not too bad. The origins of Medicare can be traced back decades before 1965, when President Harry Truman called for a form of universal health care for all Americans. A few years after that, in 1950, census data showed that 2/3 of older Americans had an annual income of less than $1,000. And less than 15% of older Americans even had health insurance. And that's important because by 1963, the number of older Americans had grown to 17.5 million people. That's a lot of grandmas and grandpas. At the same time, the cost of medical care was rising at a rate of about 6.7% a year, vastly outpacing the cost of living. So, by the 1960s, America had millions of older citizens who barely made any money, who have a higher need for medical care, which is also getting more expensive, but most of them don't even have health insurance. And this is why, on July 30th, 1965, President Lyndon Johnson traveled to
the Harry S. Truman Library at Independence, Missouri, is the scene of an historic event. President and Mrs. Johnson and Vice President Humphrey arrive for ceremonies that will make the Medicare bill a part of Social Security coverage. Mr. Johnson chose to sign the bill here as a tribute to former President Truman. The former president campaigned for Medicare 20 years ago, but it took 2 decades for his proposal to become law. The new bill expands the 30-year-old Social Security program to provide hospital care, nursing home care, home nursing service, and outpatient treatment for those over 65.
But even though it's been 57 years since the passing of Medicare, it still remains a very confusing and overwhelming program for most Americans to understand. And that's why on today's show, we will take a careful look at Medicare and we'll try our best to make it make sense. Episode 4, Medicare.
This podcast is brought to you by Bedel Financial Consulting. Founded in 1989, our client-first approach is built on transparency and trust. No commissions, no products, no conflicts of interest. Just confidence and peace of mind. Trust Bedel.
So, Kate, the easiest way I can think to do this is to take Medicare, the program, and break it down into 10 of the most important questions. Are you ready?
Let's do this.
Question number 1. What is the difference between Medicare and Medicaid? To help us answer this question, I spoke to
Kathy Hauer, and I'm a wealth advisor with Bedel Financial Consulting.
And she's going to break down the difference between those two programs for us.
Medicare is a health insurance program funded by the government. Those who work and pay into the Medicare tax are eligible for Part A at no expense at age 65. And there is also a Part B that should also be engaged at age 65 that provides additional coverage for health insurance. It only covers health insurance unless you have a disability or continued kidney failure. Medicaid is a government-provided program for those who have a financial need and can't afford care or health insurance for themselves.
So, Kate, on your 65th birthday, which is in how many years?
Many.
Many years, you will be officially eligible for Medicare. But since you are still many years away from eligibility, I wanted to speak with someone who recently signed up for and is using Medicare.
My name is Janet Holmes. I live in Southern California. I'm 68 years old, so been on Medicare for 3 years now.
And Janet is a retired school counselor, and I asked her what she knew about Medicare before she signed up for it.
It was the medical care for once you reach 65. And that's pretty much what I knew.
And that's pretty much where a lot of us are. We kind of know what Medicare is, but we really don't have a good grasp of what the program is and how it works. For instance, you become eligible for Medicare when you turn 65, right, Kate?
That's right.
But does that eligibility start on your 65th birthday, on January 1st of that year, the second Tuesday after the first full moon? When does the eligibility start? Let's ask Kathy.
It's on your birthday when you are eligible. The open enrollment period is October 15th to November 7th. And that will be the year that, that time period before you're age 65. If you turn 65, like in June, you can enroll 3 months prior to your 65th birthday or 3 months after your 65th birthday month. So you have a 7-month enrollment period for the first time you enroll.
Kathy says that the Advantage Plan, which is part of Part C, don't worry, we'll get to that later, has a different enrollment period of January 1st through March 31st. Okay, but what if it's my 65th birthday, Kate, and I'm still working and I have a health insurance plan through my employer?
If you continue to work and are covered by your employer plan, you do not have to enroll at age 65, but you want to check with your human resource director at that point to make sure that their health insurance is Medicare eligible and find out if you need to enroll in Medicare at that time or if you're able to stay on your employer plan. It depends on how big your employer is and how their health plan is set up.
So that answers our second question. Who is eligible and when can you sign up for the program? Now that we know what Medicare is, this is where things start to get a little tricky. Question number 3 is something that seems simple but can often trip up people a little bit. How do you actually sign up for Medicare?
Good question. You can go to medicare.gov, and that would be fine, I think, if your health needs are minimal and you don't have a lot of different prescriptions, if you aren't set on a certain, medical provider or something like that. You can also talk to a Medicare specialist, and we have quite a few good ones, in the area here in Indiana, and of course in all states. And each state has different supplemental coverage for the Medigap, if that's the route you decide to go.
I asked our retired school counselor friend Janet if she thought the Medicare sign-up process was difficult.
Not at all for Medicare. My husband is 2 years older than me, so he went through the process before I did. So I think that kind of helped, that he kind of guided me. And I thought signing up was very easy. I had no problems with it whatsoever, going to the website.
That website being medicare.gov. So now things are going to get a bit more complicated. It's time to talk about all the different parts of Medicare. Question number 4 for Kathy Hauer is, what is Medicare Part A?
If you've paid in Medicare taxes for at least 40 quarters, you do not pay for Part A, but that part of Medicare only covers inpatient hospitals, skilled nursing, hospice, and some other healthcare needs. It's not real extensive.
So essentially, Kate, Part A is like hospital insurance because, like Kathy says, it mostly just covers inpatient hospital visits. Do you want to guess what question 5 is?
What does Part B cover?
Oh my gosh, you don't even have the script in your hand. You can still get it right. What is Medicare Part B?
Part B covers medically necessary services or supplies, diagnosis or treatment of a medical condition, as well as some preventative services.
So whereas Part A is hospital insurance, look at Part B as actual medical insurance, covering things like medical screenings, outpatient therapy, x-rays, lab tests, etc. And we know how much Part A costs, free. Kathy told us. So question number 6 is, how much does Part B cost?
Part B, we all have to pay into based on our modified adjusted gross income.
Okay, wait, record scratch. Kate, what is modified adjusted gross income? Take your best shot.
So adjusted gross income is on the front of your 1040 when you file your tax return, and it's basically a sum of all of your incomes plus tax-free interest.
Your MAGI is your adjusted gross income plus these, if any: untaxed foreign income, non-taxable Social Security benefits, and tax-exempt interests. And the federal government is using your MAGI, modified adjusted gross income, from 2 years prior. So if we are in 2022, they would be looking at your 2020 MAGI. So, depending on your employment situation, it might be wise to work with a financial planner to adjust your MAGI heading into that 2-year window.
Absolutely. We do that all the time for our clients.
We talk with a lot of our clients about that and trying to keep income lower in the years that you know that you're going to be, applying for Medicare, or you're already on Medicare, and what can we do to minimize going into that higher tier for premiums.
Okay, now back to Kathy and the cost of Medicare Part B.
There are like 6 tiers of premiums based on your income that determines how much you have to pay for the premium. And the base premium is about $175 per person per month for Part B, and it can go up to $500 per month.
Monthly Medicare premiums can go anywhere between $175 a month up to $500 a month. And that can seem like a lot of money for a lot of new Medicare customers like Janet.
At first it was like, oh, wow, this is more than what I was paying before. But then I had to realize that my health insurance, which was through my husband's work, was also being subsidized by his company. So looking at the big picture, like, okay, take that out. If I had to be paying for everything myself, no, the cost was probably, I would say, roughly the same.
Kathy agrees that the price you pay for Part B is usually the same amount you would be paying with an employer-backed health plan. The difference is, instead of your employer subsidizing the cost of your health care plan, with Medicare, the federal government is subsidizing that cost.
It kind of is. I mean, you think about what you're paying in with your employer, it's kind of comparable. But then Part A and B is really not quite enough.
Not quite enough. All right, Kate, question number 7. What do I do if Part A and B aren't enough to cover my costs?
If that were me, I would go to my nearest Medicare specialist to see what kind of supplemental or pharmacy coverage I could get.
A lot of people buy supplemental insurance, or also called Medigap, to go along with Part A and B, which I highly recommend. If you pay for the supplemental coverage, you have very little out-of-pocket expense, especially depending on the plan that you choose for that supplement with regard to health needs. But the supplemental plan is going to be based on the provider that you choose for coverage, and it can range from Aetna to Humana. So it's more private, that Parts A and B are provided by the government. So you'd want to work with somebody at that point to find the best plan for you based on your health needs, prescriptions, and so forth.
Retired school counselor Janet says that things can be tricky when trying to find the right kind of supplemental insurance, and it's most important to find the right provider.
Wasn't so much the Medicare, it was the supplement policies. My husband, we're on different insurance packages completely. My husband, he met with our insurance guy that insures our home, and it's State Farm, and he met with him and looked over the different policies and then chose something. I just kind of listened to what other people were talking about and what their experience was. And so I went with, I did go through AARP and using their policy.
Make It Make Sense is brought to you by Bedel Financial Consulting. Fee-only, comprehensive wealth management for all generations. Trust Bedel.
We know about Medicare Part A, and now Part B. Question number 8, Kate.
Talk to me about Part C.
What is Medicare Part C?
Part B is included in Part C. So there's really no difference. C just brings in additional coverage that would supplement Part A and B Medicare. So C, again, it has prescription coverage. It has vision and dental, as well as any other medical related issues that Parts A and B don't cover. That's included in Part C.
So basically, Medicare Part C, also known as Medicare Advantage, is the government's own version of a Medigap supplement plan. Instead of buying a Medigap plan from Blue Cross Blue Shield or AARP, you opt for Part C. It's important to know while a Medicare Advantage plan, Part C, can serve as an alternative way to get Medicare Part A and B coverage, private Medigap plans only cover what Part A and Part B do not. When trying to decide between Part C or a Medigap plan, it's important to look at things like copays, deductibles, and possible future medical costs, just like with traditional health insurance. Kathy tells me that many people choose Medigap for one important reason.
Medigap is better than Advantage in that if you have a specific doctor or healthcare facility that you really want to stay with, the Advantage plan may not include your provider or even cover the prescriptions as cost efficient as a Medigap plan could. You can shop more providers and so forth through Medigap.
Question number 9, Kate. What is Medicare Part D, as in dog?
It is prescription drug coverage.
Part D offers outpatient prescription drug coverage. Enrollment into Part D is optional, and some Medicare Advantage plans, Part C, actually include Part D. Kathy Howard tells us that it is not the case if you choose a supplemental Medigap plan.
If you were to get, enroll in Parts A and B and then do a supplemental plan instead of the Advantage Part C, then you would need to enroll in an additional Part D plan for that program.
And that's it. Medicare Part A, B, C, and D. 9 questions. I have one question left, Kate. I'm not sure if you can tell by working with me, but I tend to be a little bit of a rebel. So I asked Kathy our 10th question, what would happen if I turned 65 and I just didn't sign up for Medicare? I didn't go to the website. I didn't tell anyone in the government I was 65 and ready for Medicare. What happens?
Then you better sign up within the next 3.5 months. If you don't, you get penalized, and that penalty carries forward in your premium. You're going to pay a little bit more in your premium the longer you delay enrollment, and that doesn't go away. So you want to make sure that you sign up on time.
And if you are 65 and still insured with your employer, Kathy says to remember to check with your employer to make sure their health plan is Medicare eligible. So, even if you don't think you need health insurance through an employer or Medicare, go ahead and sign up for Part A and just hope you don't get
sick or have a serious medical condition or injury, because then you wouldn't have enough coverage.
Medicare is a giant program and it can be confusing and overwhelming. When I asked Janet what her best advice was for someone who was approaching Medicare age, she told me,
talk to people. Yeah, I think that's the biggest thing. Talk to somebody, your friends who are on, what their experience, or go to an advisor, and they can lay out the different policies to fit your needs.
So while Janet continues to navigate the life of a retired Medicare user, and Kathy continues to help clients at Bedel Financial, we'll keep trying to make it make sense.
Make It Make Sense is hosted by Kate Arndt and Chris Wakefield. It is produced by Bedel Financial and recorded at IBJ headquarters in Indianapolis, Indiana. The graphics are by the lovely Amy House. And for show notes and financial news and information, visit bedelfinancial.com/podcast.